Brooke Rice, and I'm a fourth-year medical student from the University of California, San Francisco, here rotating at Matibabu for the past month. So I'll be going back to California to graduate next week, and then I'm starting an internal medicine residency program. So I have just had an amazing experience here at Matibabu. I my first impression was that I was quite impressed with the facilities here and how friendly and helpful everyone has been in getting me oriented, in teaching me how the procedures work here. And I've been impressed with the standardization of all the protocols here, and especially with the capabilities of the lab and the quick turnaround period with which we're able to get all of our tests back. And again, all of the staff here, from the nurses, the clinical officers, and of course Dr. Morgan, have trained me so much and really taken the time to show me how things work here so that I could integrate in easily. And then it's been a great experience for me in terms of learning about all of the disease processes that are here in Kenya that we don't have in the US, like malaria, like amoebiasis, like sickle cell, which although we have it, it's much more common here, and I actually hadn't seen a case prior to coming here. And then also learning about all of the same conditions that we have here in Kenya and in the US, but how maybe they're managed differently here, or how to diagnose and treat them without as many available resources. So whereas in the US, every patient who comes into the hospital, I automatically order a complete blood count, a panel of all of their electrolytes. Here, we have to think about how much money that costs. So we don't just do that as a reflex. We don't just get an x-ray right away for every patient who's short of breath. So that's taught me a lot about sitting back and thinking about what tests I actually need, how those tests will change my management, and how I can use my history and physical exam skills better to avoid ordering unnecessary labs. Some challenges that I faced here have been, although many patients speak English, some of them can't understand me, but the clinical staff here has been great in helping me translate with patients. And then I have struggled a little bit with things moving a little slowly. So for example, sometimes I'll feel the medication needs to be administered more urgently or emergently, but maybe we have to go to the pharmacy, and some medications that are less common are not as easily available. So sometimes we have to get them somewhere else, and that can take a lot longer than I feel that it should. Or for example, with blood, we don't have a blood bank here. And so sometimes it's taken a couple of days to get blood from Siaya for a patient who has a really low hemoglobin, who's not unstable, but in the US, I would have expected them to get hemoglobin right away. To get blood right away. And then also just in general that we don't have imaging here at the hospital, so that if a patient needs an x-ray or an ultrasound, they have to go to Ugunja or to Busia. And I think it would be really helpful to patients if we had those resources here. Otherwise, living in the village has been really fun for me. I have always lived in cities, so this was a very new experience for me. And at first, it took a little for me to get used to sleeping under a mosquito net, sleeping in such a hot temperature, and then not having a toilet seat was also an adjustment for me. But in general, I found my house to be very comfortable here. And the best thing has been that everyone is so willing to help me immediately. Like the power ran out and everyone was helping me get a new token and insert it. Or if I needed anything, so many people at Matibabu were always offering to help me. So I think that I would really recommend this rotation to other medical students. And I think that both they can benefit a lot, the students, and that I also think that, or I hope that there are some things that I've been able to give to Matibabu here. For example, on Wednesday mornings, I've been teaching continuing medical educations, and the hospital just got an EKG machine. And so this morning, I taught how to use the EKG machine and how to interpret the basics of an EKG. And I think that that was useful. And then currently, Dr. Morgan and I are working on creating a crash cart so that if there is an emergency medication needed, that it can be administered right away and it's available. Or if extra respiratory support equipment is needed, that we don't have to find it, that it's available. Um, but in general, compared to other international rotations that some of my friends have done, I think that this one has been much more valuable for me as a student because I've just been able to do so much. From talking to patients, to doing the physical exam, to coming up with a plan of action, and of course, being advised and mentored by Dr. Morgan to actually going and getting the medications from the pharmacy, looking in the lab, seeing the malaria, and then administering the medications to the patients. And doing some counseling as well. So, whereas in many international rotations, students just observe, I've really been able to interact here and take responsibility and see all aspects of the program, from the inpatient to the outpatient to HIV clinics, maternal child health clinics, working in the clinic in Ubunja, doing some ultrasounds, and then also going into the field with Edward and seeing some patients who have epilepsy or other neurological disorders or disabilities. So I have really learned a lot about the community of Kenya, and I feel like this has really helped my progress as a student, becoming a doctor. And I would be really excited to come back after my more training when I feel I'll have even more to offer. So thank you to everyone for my time here.